Sasa kutoka pale mpaka pale mwisho ziko 27. Tupitie.
Habari yenu? Nzuri. Wazima.
Hiyo kiweka kwa stima pale ina guruma inaweka hivi 5 minutes inajaza.
Na hiyo mkebe ndio inashika
wakati mingi kwa mingi naweza tumia hata mkebe.
Hiyo mkebe ndio kushika mbami mfuli.
Hiyo naweza tumia hiyo kwa 5 tena.
Hiyo mkebe ni ya nini wewe?
Ya kwa mbami mfuli.
Kwani hakuna nini container mzuri ya
ndio hii?
Ndio nasema unaweka hiyo is it normal standard way of doing it? That's the question.
Hiyo sio normal standard.
Yes, then why?
Nilikuwa nasema wakati imekuwa na kazi mingi tunatumia ile kama mingi kwa mingi. Lakini si lazima.
But this one
it is working. It is working.
In the for e-cars, do we use such containers for that? Some of the proper containers for carrying and bagging.
No, these are the machine.
Yeah, I see the machine. I'm
supposed to use this one only. So hiyo ni shortcut.
Kumefungwa. Hiyo shida neno. Haije. Ndio ndio biashara.
Wapi kifungo?
Abia ni atataki sasa.
Ngapi 66? 66. Yes. You're going to show you nyumbani. Ile niko nayo nyumbani sasa. Sio watu. Sasa kuna ngine mpya. Ndio pia hiyo. Kama tusi. Kama generator hata roof ya kuzuia mvua peke yake. Supposed to have a roof, and then this should be open.
Ni hata tulipata na USAID. Wakati wa bomb blast. Baada ya bomb blast tukapatiwa hii. Sasa kumaintain ikakuwa ni shida.
Kufanya tu oil maintain this one.
Tukua na hii board sasa tutaweza. Tukua na board itawezekana.
Board.
Hii mambo ya kupeleka unapeleka sita unagojea, hiyo ndio shida. Unaambia pesa imeisha na hata hujafanywa kitu na ulipatiwa budget. Kujiangalia mashine kuanzia pale. Tusirudi tena huko. Kitabu aleta kifungua. Anafungua kwa hiyo anakuja kifungua.
This one is new, isn't it? This one.
Sasa hii ndio new sasa. Hii ndio new. Ibubuki.
Sí, es que vi de mañana. Ah, médico.
Yeah. The Senate Health Committee on an inspection tour of the facilities for Nairobi County. We've had, from morning, we have had engagements with the county government of Nairobi, starting with the governor and his team. We have also had engagements with the County Assembly of Nairobi, the Committee on Health, and we have had the opportunity to visit the Nairobi Funeral Home and this level 5 facility in Mbagathi that is here. First, I want to thank the area MCA for this ward, DNG, who is a member of the health committee and has also accompanied us to his ward to visit the projects that are here. And we've seen for ourselves, and we've noted the improvements that have been done, but we have also noted the number of challenges that are there. First, starting with the Nairobi Funeral Home, we've witnessed a situation that I would not say is very good. It needs to be revisited, and we're asking the county government of Nairobi to begin work on it. One, there's a generator there that has not been working since 2018. And unfortunately today on our visit, we had a blackout that has lasted the greater part of the day, and that affects the mortuary operations. Whereas the staff at the funeral home would be committed to provide that high quality service that is required, maintain the facility to the level that is required. But if there are inhibitions in terms of equipment, then they will be deprived the opportunity to provide that. So we want to urge the county government of Nairobi, and I think the governor and his team and the area MC and the Committee for Health, to consider in their supplementary budget to urgently provide a generator for the Nairobi Funeral Home. We've also noted the issue of shortage of staff in that facility. I know it is a challenge, it is a budgetary allocation, but considering the population that funeral home serves, and the public, the majority of the public that uses that facility in Nairobi, then there is need for it to be given priority in terms of equipping and even in terms of staff. Of course, we have noted there are a number of other things that would need to be improved in that facility, but we are going to have the detailed information in our report. In this facility, we've noted there is improvements that have been done, like the neonatal ICU is complete. We are just going to see what they have been able to do there. But we have a stalled project that was started by NMS, the Nairobi Metropolitan Services. We want to urge the national government to immediately work on winding up the process of NMS and allow the county government of Nairobi to take over the project. We have information from the member of County Assembly here on the budgetary provision, indication of budgetary provision for that facility. In order for the county government of Nairobi to be able to expend their funds on this project, then it is extremely important that those old contracts that were with NMS are wound up, and NMS can on transition exist as it winds up on its debts, so that this facility can then be able to work on improving that, considering the fact that it serves a very huge population in terms of its location and placement, and also serving beyond this county. So we want to ask that that one is done, and we want to also say as a Senate that we have noted, not just in this county, and in many counties, that there are a number of stalled projects that are still being abandoned and not being properly budgeted for. Our recommendation as a Senate is that counties should prioritize completion of all stalled projects. And in this case for Nairobi County, we are asking the county government of Nairobi to prioritize completion of this facility in Mbagathi Hospital, to prioritize the completion of all the stalled buildings in Mama Lucy Kibaki. We had a visit earlier in Mama Lucy Kibaki, prioritize the completion in Mutuini Hospital, that was also done by NMS, before we budget for new facilities. Particularly these hospitals are the ones that have been upgraded to level 5, and for it to offer services of that level 5, then there is need for that completion. And we are asking the members of county assemblies to take their responsibility during budget making process and ensure funds are provided for completion of projects. As a Senate Health Committee, we are going to visit all our 47 counties within this period of 5 years, just to ascertain the situation on the ground and compare with what is in the documents. The purpose of these visits is to ensure that we give recommendation, strengthen the systems that are supposed to be strengthened, get from members of public and counties also where they need enabling legislation. This morning, in our discussion with the governor, although it was a report that was erroneously submitted to us of the funeral home, but one last recommendation we saw from the funeral home is very, very helpful. And the managers of the funeral home was asking if the period of unclaimed bodies can be reduced so that it removes the decongestion in the mortuaries. Probably that is a wake-up call. And for us, we are going to take up that matter as a committee. We want to look at it so that we consider whether the period will be reduced, or we recommend that a special funeral home be established for purposes of unclaimed bodies collected by the police from various places, so that it doesn't interfere with the operations of the funeral homes of the county. I think that was a recommendation that picked from the operational people at the facility that can be useful to the rest of the country. So we, as a Senate Committee of Health, we are going to continue with our visits. We didn't finish to visit all the facilities we had indicated, but since Nairobi is a home of every person living in Nairobi and working in Nairobi, and we have opportunity in terms of closeness to Senate, we want to commit to the people of Nairobi that as a Senate Health Committee, we are going to visit all your facilities with a view of making recommendations on how they can be improved and checking on the areas that needs to be checked on.